Yeah. I'm 100% but I'm also
good, you?
Yeah.
What do you want this one?
Grad, which is the Geriatric Research Education. And
Got your two microphones, and you should be good to go.
In about 2 minutes, there are two people who are parking the car and they're trying to get in and it's pouring rain, I'm sorry. So we just, if you don't mind, we'll try to be patient. This shouldn't take too long and hopefully we'll have a very nice lunch afterwards. We are going to be celebrating the graduation of our Geriatrics Fellows, Geriatric Psychiatry Fellows, and Palliative Care Fellows. We have accomplished a lot over the past year. Our fellows have been very productive. They have learned a great deal of geriatrics and palliative care. They have been very productive in their research fields, presented in national meetings, and we're extremely proud of them. And we have some of the new fellows here as well, and we welcome you, and we hope that you have a great time this coming academic year, and we're looking forward to working with you. Welcome especially to the families that accompany us today. We're very happy to have you here, and we hope that you enjoy this ceremony. I'm going to ask Dr. Michael Katz, our division chief, to start with some opening remarks, and then we're going to proceed to give you the certificates, because I bet everybody is hungry. So we'll do that. Thank you.
Thank you very much, Sandra. We have a full schedule, so I'll make my remarks brief. I would like to say that, I'd like to start though by saying how wonderful it is to see everyone here, and this occasion is, I guess, our second annual such occasion that many of you have been instrumental in starting. Although and it's wonderful to be at a formal recognition ceremony like this. The fellowship itself has a venerable history, and you're all part of that history. Laura Chido just reminded me that we are at the 20-year mark of our Geriatrics Fellowship. And in fact, she probably wouldn't want me to tell you who the first fellow was. So I won't. But that fellow started 20 years ago, which is quite extraordinary. And so that's where this tradition began. And so many of you around the room have worked so hard, both as trainees and as mentors and administrators, to try to get these programs underway and established and institutionalized. And that's what makes it so wonderful. That's what makes this such a venerable occasion, because we have established our own tradition. And I congratulate all the trainees, present and future and past, who have gone through these portals, and we hope that you'll take these experiences with you throughout your careers, and that you will continue to regard us as available to you for your career development. So thanks very much. I hope you can hear me. I don't know if this thing works.
It's working. Okay, I'm gonna. I'm going to call now Dr. Laura Chido, Dr. Scott Haffron, and Dr. Liliana Oaks is parking her car. So she should be here momentarily to give the Geriatric Fellowship certificate.
The riches of technology.
Okay, can you hear me?
Okay, we're going to move fairly quickly. And in alphabetical order. The first, those who have not graduated truly yet will have to return their certificates at the end. So our first soon-to-be graduate is Freddie Angulo. Dr. Angulo came to us from Texas Tech University Health Science Center Internal Medicine residency program, and will, I think, be continuing on in pain management, most likely after his fellowship completes at the end of November. So it's been wonderful working with you.
Thank you. Thank you.
Our next soon-to-be graduate is Dr. Sajani Durgam. Dr. Durgam came to us from the Palliative Care Fellowship here. Prior to that, she did her internal medicine training at Caritas Carney Hospital in Dorchester, Massachusetts. I've truly enjoyed working with Dr. Durgam, and I believe she will be in geriatric internal medicine and palliative care practice in the community when she completes her fellowship at the end of, or very early October.
I'm happy to be here, and thanks for Dr. Chido and Dr. Hartnoff to be having confidence in me, and I'm happy to be graduated. Thank you so much.
Finally, Dr. Deborah Villarreal actually has completed her fellowship just within the last week, and will be getting her palliative care fellowship soon. She came to us from the internal medicine program here, and
That's going to be a good picture.
I'm trying to figure out how to bribe you to keep some of your patients next time after doing your clinic on Monday. You definitely deserve some sort of medal for that. Okay.
Oh, there's no Mark.
Emmy.
Oh, I thought there was Dick. Mark, can you take a picture?
I'll have so much confidence in me. I've grown so much since my internal medicine residency. I can truly say that I have so much confidence that I feel I can do much more now after this fellowship. And I'm so happy for all the people like Dr. Horton and Dr. Chido who inspired me to do a geriatric fellowship. And I'm just so, I feel so blessed. Thank you so much. And I look forward to next year.
We're glad you're not leaving far away. In March, and is actually in practice in Florida. She did a one-year fellowship with us, and actually came to us from a program in New York, which name I can't remember at the present time. But I say I have not. I wish her well. Yeah.
Good afternoon. I'm Jeff Portis. Can you hear me?
Yes.
Can you hear me now?
It's great.
Yes, we've already had our graduation ceremony in our psychiatry department, but I'm very pleased that our recently graduated fellow, Diane Nguyen, is able to join us today. Why don't you come up here, Diane? Diane did her medical school training at the North Texas Health Science Center and did her residency in psychiatry here in San Antonio, and we're very pleased that she decided to select us as her place for fellowship training. She completed her training about 1 month ago and has since relocated to the Austin area, where she intends to start a private practice unless she's changed her mind since the last time. In addition, she will be a new mother of twins in a couple of months, I guess, in November, maybe so. And we're fortunate that she was able to come down today in the horrible weather, and I maybe subtract some points for her judgment for doing that. Because otherwise, she is one of the most fabulous people that we've ever had to work with. She's intelligent, she takes excellent care of her patients, she uses good judgment, and I have no doubt that she'll be able to fly and soar wherever she chooses to spread her wings. Anyway, I don't have a certificate to give her because I already gave it.
Okay, so moving on to palliative care, our palliative care fellowship program has 5 different disciplines: medicine, nursing, chaplaincy, psychology, and social work. We're gonna start by showing you all our graduates. Unfortunately, many of our graduates will not be able to be here. But this computer has minds of its own, I'm sorry. But I'm going to close them to introduce all the faculty.
Hello, it's with great pleasure that I'll be able to introduce our group. We've had such a wonderful year together, and each fellow has left a footprint on our hearts, and so this is a great joy. Can I call first Dr. Ross and Dr. Sanchez to present the certificates for the Palliative Medicine Fellowship? And we have Dr. Bharat Geri and Dr. Tahira Nawala. Are they here today? They're not here? Okay, so I guess we talk about.
Yeah, we'll talk about it.
We'll talk about them while they're gone.
This is the palliative medicine faculty, and some more that I have not mentioned. Okay. Dr. Mariam Purmamo actually wanted to be here, but because of the rain, she couldn't, her ride couldn't pick her up, so unfortunately she sends her love. Let's start with Bharat Geri. Bharat came to us, he did his medical school in India and came to us from the University of East Tennessee in Johnson City, and he completed his internal medicine residency. His main interest is oncology, and the reason why he's not here with us today is because he has started an oncology hematology fellowship back in Tennessee when he initially graduated from internal medicine. He is very bright, very caring for his patients, and very knowledgeable. And we have his certificate, and we will be mailing it to him, but we wish him well.
Tahira Nawala, she's from Pakistan, and she came to us after having completed a internal medicine fellowship, residency, and then she had done a geriatric fellowship back in Virginia. She had been working also as a faculty member, and she has been a very bright fellow and very hardworking, and her interests are in meditation, international cooking, and for her future plans, I see her working in geriatrics and palliative care both, and I don't think she's decided where yet. I know she will be an asset to wherever she goes, and we wish her well. She had personal events today, and unfortunately wasn't able to join us, but she will be finishing later this year in November.
Can you hear me?
The faculty person for the Palliative Care Fellowship to present a certificate. Thank you. Can we put up the next? Okay, great. Okay, we have the first fellow here is Beverly Murray, and I have to tell you a little bit about Beverly. Try not to embarrass her too much. You can hear me, right? Okay, well, this is the first fellow that I'm aware of that actually got a job before she completed her fellowship and without applying for the job. So welcome, Beverly. She's our nurse practitioner in ECTC, and she's doing a fantastic job. So please come up and get your certificate. And I wanted to tell you also, she's married and she's got 3 children. Two. I'm getting you confused with Denise.
My husband's a child too.
But she really is helping the nursing faculty and staff and ECTC, and always has a smile on her face, and I try to see her frequently during the week. She's doing a phenomenal job. Thank you for being here.
Thank you.
button, okay. That's her husband, Scott. Okay, like I said, we visit frequently in ECTC. And she's going to be taking the exam, the certification exam, coming up this spring. And I know she's got certification in mental health and in geriatrics, so welcome. Okay, and we have Denise Minor-Williams. And I want to say congratulations to Denise. She's been in the military. She was a major. She also has a daughter. I think her husband was in the military. Her daughter is in the military serving in Iraq. So we really appreciate your family and their support for the United States. She got her PhD in 2005. Both Beverly and Denise come from UT Nursing School. Do you have anything else coming up on this? Okay, there she is. Okay. And several parties for the group. So that's always good and brings great food. So we've appreciated that. I don't know what else you might have on your. The other thing that she has done is she has done a research study on family caregivers' perception of family meetings, and she'll be presenting that this coming year, 2008, at Southern Nursing Research Society in Birmingham, Alabama. So, thank you. Thank you.
Next, I have the pleasure of introducing our social work palliative care fellowship program, and Betty Beck is coming up to present the certificate to our fellows, and so I'll turn it over to her.
Thank you, Susan. Hi, good afternoon. First, I want to say thank you to our social work service. We've been involved in palliative care for some time, and I think this is our 5th year with the palliative care program specifically for social work. This year we had a real pleasure of having 2 fellows. It didn't drive us all crazy, but we're still standing. Dave Graves, who couldn't be here with us today for other reasons, he didn't make the cut to be here, but he's one of the faculty, as well as Susan Kranz, who's in oncology and palliative care area. I want to say thank you to Geri Rodriguez, who's here. He provides a lot of our support, so thank you. First, Emily French, who's one of the fellows who started with us last year, couldn't be here with us today.
Sorry.
David. Oh, I'm sorry. Okay. Well, if it's okay, can we get Emily in there?
Well,
That's fine. Okay, thank you. I'll just talk about her since she's not here. But Emily came to us. She's a longtime clinician in the San Antonio community. She came with many years of experience, an advanced license, EAP counselor, just many years of experience. And what I appreciated about Emily is that she was able to identify with her distinct experience as having a gap in her learning, which was palliative care. And so she came to us saying that she wanted to participate in the fellowship. She succeeded in her application. And she's a graduate of Our Lady of Lake University at Wharton School. She also received a scholarship through the ACE project, which I thought was pretty successful, and was able to travel to California to participate in that program. She also did the volunteer program. She's beginning to initiate that through our service. And the idea is to have a volunteer in the hospice area in ECTC hospice here at the VA. So she's been very busy this year. She's very family dedicated, so that's where she is this morning. Next, I want to talk about David. David came to us 1 year postmasters. He's a graduate of the University of Texas at Pan Am. Come on. David said something to me that I think exemplifies who he is and his participation in the Palliative Care Fellowship. He said this could have been the best of time and the worst time for him to be in the fellowship program. And one of the things that David also did was identify a gap in his learning and his clinical skills and wanted to advance that. So we welcomed him to the program. One of the things that David has struggled with this year, and I have his permission to talk about this, is that his father has congestive heart failure. So he is at the end of life. So David has had a distinct opportunity to stretch himself professionally and personally. And I've heard from his fellow colleagues that they have seen him grow, they have seen him struggle, and he does a really fantastic job with his patients. So I want to thank David for his participation and for graduating. He made it. Thank you.
Hello. We don't have a psychology representative. Well, we have a new representative, but we don't have the ones from past year. But I'll talk a little bit about Ann Landis. Dr. Landis just moved to Florida to take a work at the VA in Gainesville, Florida, I believe. She spent a fabulous year with us. During that year, she actually started and continue on the bereavement program that other fellows had accomplished in the past year, actually with with David Dioyos. So we were very happy to have Anne with us. This is actually her graduation party from psychology. You can see our new trainees right here. Her name is Sarah Reimer, and you will be seeing her throughout this coming year. And here's Anne. From chaplaincy this year, we do not have a graduate, but this is our faculty. Now it's important to mention Susan Roshika. Dr. Roshika graduated from our Palliative Fellowship last year, and she is currently finishing up a special fellowship in geriatrics research with our Grad. So we congratulate Susan again. Now we're going to talk a little bit about the new fellows really quickly. In geriatric medicine, if you want to stand up so everybody gets to know you, Veronica Escobar. Veronica comes from the Department of Family and Community Medicine. Andrea Alvarez, who's not here, will be joining us in September, comes from internal medicine here at UT. And Dr. Gupta will be starting sometime in November, and I don't remember where she comes from, but she just finished her internal medicine residency. Comes to us from Florida when he completed a geriatrics fellowship, and prior to that he did his internal medicine residency at Texas Tech in Lubbock. And Dr. Debbie Villarreal, who you all know, she's a veteran here, and she will be continuing on to do her palliative care fellowship. We have Dr. Reimer, who is at the back, and she just started her palliative care psychology fellowship. And we have Nicole Kirby, who is our new chaplain fellow, will be starting sometime in September.
We're also going to have a new geriatric dental fellow beginning in September. Her name is Dr. Pam Van.
Wonderful. Okay, thank you. Here are just some picture with fellowship moments. You can recognize some of those faces. Lots of food, lots of meetings. Lots of happy moments, and again, we thank you very much. There's Dr. Promomo. There's Chris Audie. That's our famous staircase.
Freddie. Tell them about Freddie.
And now we're going to talk a little bit about a couple of people that we wish to recognize. So I'm going to ask Dr. Katz to come up. Geri, come on up.
Oh, we gave away the punchline. This is so many wonderful awards on a day like this. Always reminds me of the Wizard of Oz. And I think that the first special award goes to someone for his brains and his heart and his courage in supporting the fellowships for all these years. Jerry Rodriguez, who's in Geriatrics Extended Care, has really done this as something of a sideline, if you will, but without your scheduling capabilities, Geri, and all of your familiarity with the resources and challenges of our local environment, these programs wouldn't exist. So this is a certificate of appreciation to Gerald Rodriguez in recognition of his dedicated support to geriatrics and extended care educational and clinical programs. Thank you so much.
Okay, Dr. Holcomb, if you could come up, please. I really wanted to surprise Bill today by bringing his wife here. And I tried to call, but every time I call, he will answer the phone, so I had to hang up on him.
So you're the one.
And I really tried. I didn't have, so I just tell you what, I really wanted to speak with. Maybe I should get her cell phone number or something. Dr. Holcomb is a professor of English, retired from San Angelo State University. And Dr. Holcomb joined our university 2 years ago. Yeah. When he started working as an active faculty member at the Center for Bioethics and Humanities at UT. He started teaching medical students, and we met last year. And I asked Dr. Holcomb, why don't you come and join us, and maybe you can teach our fellows some ethics. And he's done a wonderful job. He's a voluntary faculty, and he comes here and gives us clinical ethics cases. He teaches our fellows ethics. He's an active part of our palliative care team. So we wanted to show you how appreciative we are of your work here. And this is for Dr. Philip Holcomb in recognition of his invaluable contributions to the education of geriatrics and palliative care trainees.
Thank you very much.
And last but not least,
All right, well, we want to recognize Michelle Saunders. She is always the lady behind the sidelines. She is so important for us in helping us with our education, and she has many hats that she handles very well, but I'm going to read because there are so many. But okay, so she's the director for the Grad, and she is in charge of our education, and she's the one that puts all of our programs together. And this year has been very special because with little funding, she has managed to still continue giving us excellent education. And this year she's also had to write many grants, and she has helped us applying for grants, and she stayed up late with very little sleep, reviewing all of our grants to make sure that we were applying on time. And so we really want to congratulate you, and we have a little something. This is a spa day, so hopefully you enjoy it and relax in compensation. But the award we want to give you is in recognition for your unwavering commitment to geriatrics education and superb mentorship. And thank you, Michelle.
Thank you.
now we're going to call Dr. Oates and Dr. Alper from the Department of Family and Community Medicine Division of Geriatrics, and they will be doing our closing remarks. Dr. Oates just came back from vacation, as you can see.
I went to the Bahamas. Well, many of you probably don't see me around the veterans, but I'm one of those ghosts that belong to family medicine, and once in a while have the opportunity to just come to these great events. And we just wanted from family medicine to express the congratulations to all of you. Dr. Parker usually does this, but he's in a sick absence right now, so he's recovering well, by the way. We just are very proud of the conjoined efforts that family medicine and internal medicine are doing to improve the care of older adults by training our geriatric fellows. Little history, we give the opportunity to the geriatric fellows to train in our clinics. We enhance their education by training them at the nursing home and all the administrative and clinical aspects. We do research with them. And the most important thing, we have a great commitment to the nation and to the world to prepare all of you to be representatives of a very rare species that I hope doesn't become extinct, which is the geriatricians and the geriatric fellows and palliative care fellows and social workers and chaplains that are committed to improve the care of older adults. So just a few words to say congratulations. I hope that your time with the institution has been great, expand, and that you can definitely take all of this knowledge and passion for your older adults and represent San Antonio and have also these fun memories that we saw in the pictures. Again, thank you very much and great ceremony.
Okay, well now that we're all hungry, we're gonna have some lunch, so if you can just head towards the 3rd floor nursing conference room. It's C303. Just take the main elevators to the 3rd floor. Before we do that, we're gonna take a group picture. So if you can all come up here to the stage. Right here, this is just everybody.
Can we put the screen up so that Sorry, we always keep
She can get more. Whoops, excuse me. Would you like some? Okay.
Fall.
Did they sign mine? Yeah, mine's down.
Jennifer, make yourself comfortable.
Yeah, I know.